Hi, my name is Madison. I'm a nurse practitioner student. How are you today?
Good, how are you?
I'm good. Today we are going to be doing a complete head-to-toe physical assessment. Is that okay with you?
Mhm.
Okay, perfect. So first, I'm just observing that she has normal coloration to her skin. She has good hygiene. At first glance, there are no visible lesions, but I will further look into that here directly. I'm just going to take a look at your arm. Her skin is warm and dry. She does have some small papules, but nothing of any concern. Let's take a look at your legs. Good. The texture of her skin is smooth. Just gonna feel your back. Good. When assessing her skin is very symmetrical. Her skin is smooth. I'm going to test the trigger of your skin. Sorry. She has normal skin trigger. Now, so now I'm just going to take a look at your nails. The angle of her nail bed is approximately 160 degrees, which shows that she has no evidence of clubbing, which is a good thing. Right now I'm just going to feel your head. Any pain or tenderness when doing this?
No.
Good. Her scalp and skull they are symmetrical, normal shape. There were no lesions felt. There were no tenderness upon palpation. Can you look at me and smile? Perfect. She has facial symmetry. No unusual features of her face. Pigmentation is regular. It's consistent with the rest of the color of her skin. No ticks were noted either. Now I'm gonna take the glasses off. Perfect. I'm just gonna palpate your mastoid and frontal sinuses. Is there any pain with any of this?
No.
Okay, good. Now I'm just going to continue palpating your neck. Upon previous inspection, her neck was symmetrical. It is midline with the rest of her body, as it should be. She has, can you head down, head back, and then side to side? Perfect. She has full range of motion in her neck. Now I'm going to come behind you. I'm going to palpate your trachea. Can you swallow for me? Perfect. Her trachea is midline, and then upon observation of other swallows, her hyoid bone does move properly. Now I'm going to palpate her lymph node chain. In front of her ears is the pre-auricular, post-auricular, occipital. Any pain with any of this?
No.
Posterior, carotid, anterior carotid. Her supraclavicular nodes. Go ahead and relax. Submandibular and submental. Good. Perfect. Now I'm going to just palpate. Can you open and close your mouth for me? Perfect. There was no crepitus noted in her temporomandibular joint. Now I'm going to begin the vision tests. I'm going to step back here. Can you read the...
With or without glasses?
We'll do without. Can you tell me which line you could read?
The third.
Can you read it for me, please?
FPH.
Okay, now can you cover one eye and read it again?
FPH.
And switch.
FPH.
Okay. Now I'm going to have you cover either of your eyes again, and can you tell me how many fingers that you're holding up? Or I'm holding up, I'm sorry.
2.
Okay, how about now?
Same?
Yep.
2.
Okay, now switch eyes.
3. 4.
Perfect. Now I'm inspecting her face, specifically her eyes. Her eyebrows are symmetrical on her face. Her orbital area looks good. Can you look up for me? Perfect. Eyelids, there's no tics, fasciculations noted. There's no puffiness, swellingness, or redness. Her conjunctiva and sclera, they are in good condition. They are white and clear as they should be. External eyes, I am going to examine your eyes. I'm just going to have you look straight ahead. Her pupils are round, reactive to light and accommodation. Her pupils are approximately 4 millimeters in size. There were no blood vessels present on examination. Let's see. Now I am going to do the afferent pupillary defect testing. No, I'm sorry. Now I'm going to do the accommodation, and I'm going to have you look that way as I shine a light on the bridge of your nose. Good. Now I'm going to do the 6 fields of gaze. I'm going to have you focus on my finger. Perfect. I'm going to have you cover one eye, and I'm going to have you look at that door. All right, now uncover this eye. Good, and then switch and do the same thing. And uncover. So I'm just going to take a better in-depth inspection of your eyes. I'm going to, red reflexes noted. She has clarity to her lens. Her veins were larger than her arteries. There was no AV, nicking, or wool spots noted in her right eye. Now I'm going to assess the left eye. Good. Same thing with the last eye. Red reflex was present. She has veins larger than arteries. No AV nicking or wool spots present for this eye either. Now I'm going to assess your ears. After I change. Alright, now I'm just going to feel your ears. Is there any pain with any of this?
No.
Okay, good. Let's see here. Now I'm just going to take a look.
Mm.
There. Good. Good. Now I'm going to assess your hearing with the Weber and Rhine test. Just tell me, I'm going to place this midline on your scalp and you tell me if you hear it in one ear or both ears. And then just tell me when you stop hearing.
I stopped here.
Can you still
Yes.
hear? Side, just tell me when you stop hearing it.
I can't hear it anymore.
And can you still hear it now?
Yes.
Okay, perfect. Now I'm going to perform the whisper test. I'm going to have you include the opposite ear. So in your case for this one, it would be your left ear. And I'm going to whisper and you're just going to repeat back to me what I say. Okay?
3, 4, 7.
All right, perfect. Now we'll switch sides.
ABD.
Perfect. Now I'm going to inspect your nose. Just gonna palpate. Any pain, tenderness with any of that? Okay. Now I'm
No.
just going to take a look. Now can you occlude one of your nostrils and then just continue breathing for me? And switch. Good. You have patency in both of your nares. And now your lips, they are not chapped. They are not cyanotic. They have regular coloration to them. Can you open your mouth for me? Good. There are no cavities or caries noted whatsoever. Her tongue is symmetrical. All right, can you say ah for me? Good. Now I'm going to begin the respiratory part of the assessment. Just visualizing the patient, she seems to have a very regular respiratory rhythm. There is no use of accessory muscles, anything like that. She has a very symmetric chest expansion. Her AP lateral diameter is also as expected. Now I'm going to listen. There are no audible sounds to a naked ear when standing near this patient. Now I'm just going to take a listen with my steps. Just take deep breaths for me. Now lift your arm for me. Okay.
Oh.
Go ahead and just take some deep breaths. Good. And the other side. Now I'm just gonna listen to the breath. Take some deep breaths. And one more. Okay, now I'm going to assess your thoracic expansion. Just go ahead and take a deep breath for me. Good. It's symmetrical. Now I'm going to have you say 99 multiple times so I can feel for tactile premises. Go ahead.
99, 99, 99, 99, 99.
Perfect. Now I'm going to have you say 99 over again, but this time I'm going to listen. Go ahead.
99, 99, 99, 99, 99, 99, 99, 99.
Good. Now I'm going to begin your cardiovascular exam. I'm going to first inspect the patient and good. On inspection, there are no pulsations or heaves noted. Also no lifts noted. I'm now going to palpate to find the point of your apical impulse. It is felt at the 5th intercostal space, mid-clavicular line, which is where it should be. Now I'm going to palpate with the palm of my hand for any thrills. There are none. Now I'm going to listen to your heart sounds, starting at the aorta, the pulmonic, Erb's point, tricuspid, and the mitral. I'm again going to assess those same locations, listening for murmurs. And there were no murmurs heard upon auscultation. I'm now going to begin the abdominal assessment. I'm going to lift up your shirt if you don't mind. So looking at the skin of the abdomen, the patient has skin that is consistent with the skin on the rest of her body. I can't really test the venous pattern return due to there's no veins that can be easily assessed on this patient. The surface motion and the symmetry of her abdomen are regular. I'm going to have you raise your head for me and put it back down. When she raises her head, there are no masses, hernia, or separation of the muscles noted. I'm going to go ahead and put this back down. I'm now going to listen to your bowel sounds. And now I'm going to auscultate and listen to the arteries for any possible bruits. Starting at the aorta. The left iliac artery. I'm sorry, the left renal artery, the right iliac, and then the left femoral, and the right femoral. Good, there were no bruits noted. Now I'm going to percuss the stomach. Good. Now I'm going to percuss to find your liver borders. Let's see here, can you relax pressure on. Due to the bra and the breasts on this patient, I am unable to assess the liver borders, so now I will move to assessing for splenic dullness. Good. And then going to percuss for a gastric air bubble.
Miserable.
All right. Now I'm going to do light palpation of all 4 quadrants. Is there any pain with any of this?
No.
Alright, is there any pain with this?
No.
Perfect. Now I'm going to percuss around her umbilicus and umbilical ring. Now I'm going to palpate for your liver border. I'm going to have you take a big deep breath in and out. Good. Now I'm going to palpate for your gallbladder.
I don't have one.
That's very helpful. Now I'm going to do you have a spleen?
Yes.
Okay. Now I'm going to palpate for your spleen. All right. Can you take a big deep breath? And out. Good. Now I'm going to do your kidneys. Good. And switch. Perfect. Upon palpation, there were no aortic pulsations felt or any other masses felt. Now I'm going to assess the patient's blood vessels. I'm going to palpate all of the pulses in her distal extremities. I'm going to do your carotid first. And the other one. Good. Your brachial. Okay. Your radial. Your femoral. Okay. Good. All pulses a +2. They're normal, not bounding. I'm going to inspect for jugular vein distension. Can you just? There's no jugular vein distension noted. Going to inspect your peripheral veins and arteries. Okay. And there is no tenderness or pitting edema upon palpation. Okay, now the last section of your head to toe assessment will be the musculoskeletal. I'm going to palpate your wrists and hands. Is there any pain with any of this?
No.
Okay. Can you bend your fingers forward and up? All right, and then the wrist forward and up. Okay. Now can you touch? All right. Now hold it on your pinky, and make a fist. Perfect. Can you spread your fingers apart? And now together. I'm gonna have you start with the palm down and left and right. Perfect. And now I'm going to apply opposing force. I'm gonna have you lift your hand up. Your hand. All right, and push against me. Good. Switch. And against me. Perfect. Now can you grip two of my fingers with your hand? Perfect. Grips are very strong. So now I'm going to have you extend and flex your elbows. Perfect. Now I'm going to do the same. Go ahead and relax. Good. Good. Just feeling. Any pain with any of that?
No.
Alright, now I'm going to have you flex and I'm going to apply opposing forces and just push against it. Alright, now the other way. Push against my hand. This hand.
Oh, this.
That. Alright, now pull towards you. Good, now push away. There we go. Perfect. Now we're going to do your shoulders. I'm just going to inspect. Any pain?
No.
Okay. Can you shrug your shoulders for me? Can you raise both arms over your head? Can you extend and stretch behind your back? Perfect. Swing each arm in front of your body. Place the arms behind your hips. Okay, behind your head. Perfect. And then I'm going to apply force and just have you shrug your shoulders. Good.
This is like Simon Says.
Now I'm going to feel your temporomandibular joint. Can you open your mouth for me? Okay, and close. I'm just going to have you open and close your mouth again. And side to side. And then front and back. Perfect. Okay. Now we're going to do your cervical spine. We're going to just feel your neck. Good. Can you bend your head forward and side to side and then side to this side? Perfect. And then I'm just going to have you, yep, and then this way and back. Okay, and forward. Perfect. Now I'm going to assess her thoracic and lumbar spine. I'm going to palpate along all of your spine. Does any of this hurt?
No.
Good. Now I'm going to press down your spine. Is there any tenderness with this?
Yeah. No, sorry.
Okay. Now if you can stand up for me and touch your toes. And now stand straight and extend back. And then side to side. Perfect. And then can you... Perfect. Now, standing, I'm going to have you swing your legs back. Good. I believe... And while she's standing, I'm looking that she is weight bearing and there are no issues with her, with her ankles. The alignment of her feet are normal. The alignment of her toes are normal. She has a normal number of toes. She has 5 on each foot. Same thing with her hands. When inspecting her hands and wrists, she has 5 fingers on each hand. Now, to complete the assessment, I'm going to finish assessing your legs. Thought if I was describing? Maybe not. Alright, so I'm going to raise your leg. Down. Down. I'm going to bring your knee to your chest. And over. And this way. Good. This way. This way. Perfect. And I'm just going to palpate. Good. Can you point your feet forward, back towards you? Perfect. Go ahead and relax. And then side to side. Good. Can you bend and straighten your toes? All right. Now, pull back towards you and push back towards me. All right. That completes my assessment. Do you have any questions for me?
I do not.